Hello, viewers and Protean Pulse subscribers. Thank you for a wonderful start to this year. We have a great lineup of guests for 2026. And this is Rajee Hari, and welcome to Protean Pulse Healthcare Podcast. I am the CEO of a healthcare staffing company, Protean Med, and we are a solution provider based out of the Woodlands, Texas. And today I have an exciting guest, Cory Kleinschmidt. He is the founder of Locumpedia. It's an independent locum tenens industry platform that offers industry resources, tools, and a free job board. So since 2000, he's been a veteran in the field and he's been a leading expert in the industry. And he's worked with Rick Jackson, developed the locumtenens.com. That was the initial digital strategy that he developed for them. In addition to managing and guiding the Locumpedia's platform, he also consults for notable agencies and vendors. And I always look out for his insights and his little tidbits from Locumpedia for my organization and how I can fine tune my strategy in my work as well. So welcome to Protean Pulse, Cory.
Thanks, Rajee. It's good to be with you.
Thank you. Thank you. It's always been a pleasure interacting with you. You've got this pleasing smile. And as I said, I always look forward to seeing you in your pink jacket in every conference. So anyone who's listening, don't miss seeing Cory in his booth in NALTO that's coming up. He's got little treats that you don't want to miss. I always grab a couple when I go to his conference, to his table. And he has great information and he's a great resource for any staffing industry person, be it a locum or a vendor, whoever it is, he will be a go-to person for all your strategies. So, Cory, let's start with the first
clarify really
question.
quick. I wear the pink jacket. I wear the pink jacket because it's part of our brand colors.
Yes. I know. It's the branding of Locumpedia, which is pink. So they have this
Yeah.
beautiful pink jacket. I look
Blue
at it
and
and
pink.
I'm like, I want that pink jacket. So that's how cute it is. But Cory, of course, he carries the brand forward with that pink jacket. So just for clarification purposes. Yes, Cory, and you've been in locum tenens since 2000, long before all this job boards, the MSPs and the VMS, the automation, the AI. Kind of let's zoom out a little bit and let me ask you, how would you describe the evolution of this industry over the last 2 decades?
Well, it's changed a lot. It's kind of hard to believe. I've been doing this for 25 years. Some people call that a quarter of a century. It sounds really old when you say it that way. Like a lot of aspects of the business world, technology has changed a lot. The internet has changed a lot. And I think locums has changed along with it. Of course, healthcare in general and staffing firms are historically notoriously low tech, lo-fi, not very tech savvy. And the information space has always been very fragmented. And so, back then, 25 years ago, it was a very what I would call an analog industry, emphasis on phone calls. When I joined Jackson Healthcare, before it was Jackson Healthcare, the telephone was the number one recruiting tool, even before email marketing. And so one of the things that I did with my background in technology was help Jackson Healthcare come into the 21st century, building digital systems for all of Jackson's companies. And to that point, email marketing was very rudimentary, was very, I would say, probably episodic. It wasn't an embedded part of the recruiting workflow, let alone texting like it is today. It was a very different time. In terms of the healthcare industry, it treated locum tenens back at that time as more of a short-term gap solution. It was, the phrase that I heard a lot was necessary evil. Health systems, hospitals, clinics didn't want to hire locum tenens providers. They would only do it as a last resort. So again, necessary evil. But as the healthcare industry evolved and the trends that led to locum tenens becoming a necessity accelerated physician burnout, retirement, shortages, and all of those macro trends kept snowballing. Mm-hmm. And also back then, it was more of a relationship, based business, more of a slow kind of a slow burn, very kind of, again, very analog, discussion based. You can only make so many phone calls in one day as
In a
opposed
day.
to email marketing and text marketing. Now you can send campaigns at scale. And so yeah, it was a quainter time, let's say. And technology has really changed that significantly.
What hasn't changed?
Well,
What is one
certainly
thing that has?
relationship.
Mhm.
Yeah, I mean, it's one of my clients likes to say that as much as technology has changed locum tenens staffing, it's still a relationship business. Staffing in general is still a relationship business. The need to get to know providers on the recruiter side has not changed. The most successful recruiters I've seen are the ones who form the most long lasting relationships with providers. So while technology has facilitated being able to reach more um, providers and clients, it hasn't changed the fact that I don't know if I would say most
Interpersonal.
providers, but a significant percentage of them want a recruiter to be sort of a sounding board for them,
Mm-hmm.
almost like a career counselor, as
Mm-hmm.
opposed to just being part of a transactional relationship where they're just a commodity to be bought and sold. So that hasn't changed. But again, technology and of course now AI after email
Mm-hmm.
marketing and text marketing have accelerated or broadened the ability to reach more providers at scale. But in the end, if you want to succeed, you have to build strong relationships, and that fact rewards, I think, staffing firms that spend more time on building relationships, which tend to be most likely the smaller, medium-sized agencies, as opposed to the larger agencies where it is about volume typically.
Mm-hmm.
The firms that are doing well or will do well in the future are the ones who can capitalize on these technology trends while also, sort of like a hybrid approach, retaining the best of the old world and embracing, the new world. Providers are people, doctors are people, of course, and they're complicated people. They're complex people. They're highly educated. They're widely seen as heroic parts of the healthcare industry, and so they're increasingly wanting to be treated appropriate,
True.
commensurate with that status. And it's like if you're it takes a really well-rounded person to become an effective parent to a child. It's the same thing. You have to understand what makes people tick, and it's different with different specialties
That's true.
to get to become confidants
Mm-hmm.
for these providers.
True, true, true. So you mentioned that it was seen as a necessary evil. The locums were considered to be short-term gap fillers. Today, many systems they rely on this strategically for locum support. What do you think has made that shift?
So rely on what specifically?
Strategically, they look at locums as a part of their yearly growth, yearly fill. So, what do you think has caused the shift from considering it as a necessary evil to a um, strategic requirement for an organization?
I think a good way to look at it is that these trends about burnout, physician shortages, early retirements, paperwork burdens, and things like that, all of these trends, they've been around for a long time, but they've accelerated in recent years. And so, in a lot of ways, the way to look at that is instability in the system has become endemic. Then, on a separate track, you've got the rise of the gig economy over the past 20 years,
Right.
largely enabled again by the internet and digital systems, now increasingly physician staffing specific platforms, technology platforms. And so, that fragility and that instability has become a permanent factor of the healthcare system. And so, of course, COVID supercharged those trends,
Yeah.
both in terms of adoption of technology with remote onboarding, remote interviews
Mm-hmm. Mm-hmm.
of all kinds.
Yeah. Yeah. I guess.
Healthcare
Mhm.
facility margins are still razor thin, and so they look at it as more proactive solution as opposed to a cost. So more of like a potentially a profit center, or at least protecting revenue in the face of all this instability, as opposed to a cost center.
That's interesting. Yeah. I mean, that's a bigger thing, right? Whenever we approach an organization, they do talk about the numbers and they do talk about their margin, but they still need the locum. because they have that need. The patient care needs to be sustained, it has to be continued. So it's kind of like a balancing act from all ends, I guess. So when do you think this technology truly started influencing the locum staffing? What was that inflection point? Was it the job boards, or was it the digital credentialing that has come up? I know the credentialing is still long and laborious, but it's still much better than what it used to be. Or is it data transparency? People seem to be willing to share data now than before. What do you think was the inflection point?
Yeah, good question. Again, a lot of these trends are converging from different angles. So on the provider side, definitely I agree that, online job boards changed the equation significantly because providers had a way to check on what's out there.
Mm-hmm.
Permanent placement docs, W-2 employees, or own their own practice or whatnot. It was really hard to get a hold of that information unless a recruiter contacted you and you were patient enough to listen to their sales pitch. But it gave the clinicians an opportunity to kind of like explore the locum lifestyle conceptually by saying like, hey, well, I'm a radiologist. I'm licensed in Idaho. Sure, would be kind of neat if I had the chance to work, kind of take a lifestyle approach to medicine. And I'm big into skiing and mountains and whatnot. And so it gave them visibility into a different world that was emerging. There was a long gap between the late 90s when physician job boards emerged and the other trends that have brought us to where we are now came into full effect. So being able to discover jobs online was kind of an initial step. You mentioned credentialing, because on the client side, healthcare facilities are now more experienced with dealing with locum tenens providers as well as the staffing firms, and so they have more experience handling credentialing. They know more about. They have sophisticated software that helps them understand the cost of not having a provider. So if they lose patient revenue by not being able to service patients and having to turn them away to other facilities. So I mean, really, in a lot of ways, again, technology and COVID, that's kind of like the standard answer to a lot of what's happened, especially in the last, well, now 6 years, but going back about a decade ago in the industry, the business world at large, you started to see the, platformization of every workflow in the business world, and including in healthcare. The accumulation of all of these platforms um, and time, and maybe that's another ingredient that goes into all this. It takes time, just like we're seeing now with AI, and we're seeing it firsthand with our experience with AI. It takes time for people to become exposed to something new and to understand it and then absorb it and then to be able to deploy it skillfully. So all of those things take time, but then, of course, time can be accelerated when you have things like a once in a century pandemic.
Oh, yeah.
Where the world went remote and the healthcare staffing industry in general had to grow rapidly to respond to the COVID crisis. So then, of course, I think another thing not to be overlooked is that back to healthcare systems and their razor thin margins, they're looking for ways to utilize data and analytics and software to cut costs in their staffing and management operations. And so I think you'd have to see vendor management systems as part of this acceleration. When necessity is the mother of invention, that's a pretty apt phrase here. So and then if the health systems are saying, hey, if you want to provide staffing solutions to us, you have to use VMS platforms. I think that's a big factor. And then also managed service provider models. A lot of these things were kind of starting to germinate in the early 2010s, 12 to 2015 or so. And so these aren't new trends necessarily. It's just how all these converging factors are coming together and building a new system right in front of our eyes now with AI.
That's interesting. Tell me a little bit about Locumpedia. What exactly is Locumpedia, and how did you start on your journey in Locumpedia so far?
Well, we use the P word, platform, to describe Locumpedia. We're the only digital platform serving the industry. We combine mentioned earlier in our discussion. Industry News, we're the only publication covering the industry. We create physician career guides for those looking to get into locum tenens. We provided free job board for staffing firms, direct employers, and of course, providers. It's totally free, no fees whatsoever. So we set out to be the central hub of the industry because it was true back in 2000, and it's still true today that the industry is very fragmented, even as we see various technology platforms spring up like Locum Smart, Modio on the credentialing side of things, new locum specific CRM ATS platforms like Assist built on top of Salesforce. So, we saw an opportunity to become the central hub of the industry and build a business around being at the intersection of all these trends, chronicling the industry, introducing locums to providers, as I mentioned, but just becoming the central source of authoritative information on this rapidly growing industry. And like a lot of businesses, COVID, especially in healthcare, COVID set our plan back by a couple of years, but in the past 3 years, we really hit our stride. And as you alluded to earlier, we're now consulting for other companies and looking for ways to monetize our platform to provide increased value to our stakeholders. And we're uniquely positioned, I think, to succeed in this because we truly are independent. We don't play favorites. We are an equal opportunity platform for any agency. Again, we have the free job board. Doesn't matter how big or small you are, you're welcome to use it at no cost. We've gotten a lot of great feedback over the years that we've sort of achieved our mission of becoming the central hub of the industry. And again, I conceived it, I would say, probably at the end of my run with Jackson Healthcare, saw an opportunity for one organization to claim the mantle as the central source of everything locums. And took quite a while to find an investor, but I did. And the vision that I had back in like 2005 kind of finally came to fruition in the late 2010s, 20 teens. But yeah, it's just unifying the industry, kind of trying to build a community, respond to what the industry needs and wants, and let everyone play in this sandbox. This year, we're poised to really take it to the next level. We have a lot of exciting things coming, and looking forward to revealing those when the time is right.
I'm looking forward to it. As you said, you're the only digital platform for locum tenens, and the industry news, the latest, the movers and the shakers. And I get most of my news from you, and I follow you on LinkedIn as well. So I look forward to the Locumpedia emails. And if anyone out there is listening, you may want to go and check out locumpedia.com and subscribe to their newsletter, and also follow Cory on LinkedIn. It's a great resource for you for sure, and you will not regret it. You will love it. We talked about the pre-digital age. We talked about the digital age, how MSPs, VMS, the credentialing, and slowly how AI is creeping into the healthcare. So let's talk a little bit on the AI technology. Wherever we go in the staffing conversation, AI is there. It's there everywhere. And from your perspective, what's real and what's hype in terms of locum tenens?
Well, again, I would say that this industry is, affected by the same trends as the business world at large. There's a general sense that AI is going to revolutionize all aspects of business, and especially businesses that are based on data, which largely I would say locum tenens. I mean, again, it's very relationship based, but there's a lot of data that influences how strategies are developed and success is measured. But I would say, so it's definitely emerging. I would say right now, again, as in the economy as a whole, hype rules the day. Of course, we're still kind of in this gold rush era. And when you have times like these, you have a lot of charlatans promoting their own vision of AI. You have a lot of so-called thought leaders coming out of the woodwork trying to capitalize on this opportunity to be seen as an AI expert. And so as a result, there's a lot of hype that flows from that. So the hype, again, I'll just keep with the hype theme, but back to relationships again. Some of the hype we're seeing is that AI is going to, replace the staffing industry, or it's going to replace recruiters, or it can be automated. There's always going to be that holy grail with any industry. to the detriment of the workforce, especially junior level employees or recruiters. For now, that's hype. It's not to say that that won't happen as, again, companies develop playbooks for how you can automate various parts of the locum tenens staffing process. But right now, it's very hype driven. What's real, I would say, is workforce automation. And I can attest personally, that's what we're doing in our work to be able to source news more quickly, to analyze it more quickly, to publish more quickly. And that's one of the things that we're about to launch with Locumpedia is a weekly news schedule as opposed to biweekly, largely as a result of using AI-driven workflow automation. So I'm seeing a lot of that in the industry as well. And then on the staffing side, credentialing has dramatically been streamlined because of AI-driven tools like Modio and others that are replacing manual effort, leading to faster outcomes, but also, fewer errors, removing the human errors like typos and things that can
That's also
slow
laborious. The
down
time is a
start
huge,
dates.
sorry. No, I think it's
Yeah,
also the laborious process of time, time consumption. So if you can reduce the time to fill, then that's an added advantage. So I think credentialing is a major hurdle there.
absolutely. The same thing on back office operations, reducing administrative drag. It's still early days though.
Mm-hmm.
I think eventually someone's going to develop, it might be us, stay tuned, a truly AI driven locum tenens staffing platform that
Mm-hmm.
combines all these elements. I'm sure we're not alone in spending a significant amount of time testing AI
Mm-hmm.
workflows, developing custom AI tools
Mm-hmm.
that are built around your own, as opposed to staffing platforms that you have to adapt your workflows by and large still
Mm-hmm.
to their platform and how their software operates. In the next 2 years, companies are probably going to replace off-the-shelf software and even custom software, a lot of CRM ATS platforms, and roll their own with
Mm-hmm.
vibe coding, with AI analytics. It's pretty powerful when you can have a data source and you can create an app just
Mm-hmm.
from typing some words. So
It's
you're
true.
going to see companies, I'm sure the larger companies in the beginning, they're already doing it, in fact. And then there will be vendors that will develop and market comprehensive end-to-end
Mm-hmm.
AI-driven platforms. Again, as I
Yes.
said, in probably within 2 years. So it's
Yeah.
going to change very quickly, like, again, the world around us. And it will be very interesting that, the data plus value plus speed are going to, and plus, with private equity money coming into the locums industry, um, we're going to see a continuation of mergers and acquisitions activity. As a lot of people probably are aware, Locum Tenens is the only healthcare staffing vertical that is still growing
Mm-hmm.
and is on pace to grow 5% this year, according to staffing industry analysts. All of this opportunity is going to lead to custom solutions built by AI.
Absolutely.
So a lot of automation coming.
So where do you see in 3 to 5 years? Where do you see the industry going? Is it going to be more automated? Is it going to be more embedded? Is it going to be provider driven, or is it going to be the client dictating the industry? Where do you see it going in future?
It's all of those things. Again, all of these trends are, I think about this a lot, and I wonder, like, is this just coincidence that all these trends are converging, or
Mm-hmm.
is it? I'm sure it's not. I mean, it's not a coincidence, but it is. It's a bit. Um,
Maybe
it's
evolution,
just
I would
really
say.
interesting. What's that?
I thought it's more like an evolution of things, like how it is all flowing into the next big thing in the industry, right? It's all just evolving into
Yeah,
that.
I agree. Definitely an evolution, but it's driven on all. Just looking at the stakeholders. So on the clinician side, yes. I mean, we work with a CPA that specializes in locum tenens providers, and we've helped them build a really strong business in just less than a year and a half. And
Nice.
so we hear from them how many providers are coming to them because locum tenens and the gig economy are converging and have been for quite some time. And provider burnout. Shortages are creating this opportunity on the provider side to say, you know what? I'm going to do locums full time. So we're seeing that a
Mm-hmm.
lot. Younger clinicians out of residency are saying, hey, before I settle down, I want to travel. I want to do locum tenens assignments and figure out where I want to work, what kind of facility, where in the country, or maybe they commit to doing locums full time. So on the flip side of that, as you mentioned, Raji, is the clients are realizing the reality, which is that they're going to have to turn to locum tenens providers if they want to maintain continuity of care in the face of all these trends that are jeopardizing their revenue.
Mm-hmm. Mm-hmm.
And again, they're pushing a lot of staffing firms into staffing platforms, VMSs and MSPs. And so I think in the end, what we're going to see, of course, the technology world is trying to build a better mousetrap and capitalize on all of this opportunity, as I mentioned. I think in the end, what we're going to see is hybrid models. So you'll have internal teams, agencies, and locum tenens platforms working together in a more synchronized way. I think that's what we're going to see in the next 3 to 5 years. I hesitate to make any predictions 5 years out because of how much AI is changing things.
Yeah.
When you hear people like love him or hate him, Elon Musk saying by the end of next year or in the next 2 years, we'll all have humanoid robots
Yeah.
in our homes. When you think about how something like that could become mainstream quickly, and it's hard to see what happens after that. Of course, the big tech companies, Apple, are making it easier than ever to treat their phones as chatbots, AI powered chatbots. For the past 10 plus years, people know that Siri on iOS is not very helpful, but these big tech platforms, OpenAI, Anthropic, and a lot of them, Microsoft, Apple now are rushing to make it so that we can communicate with our devices easier than ever before.
Easily.
When we all have these, OpenAI and Apple now are both trying to develop devices that don't even use screens, that they're AI
Mm-hmm.
powered. You have earbuds, you have other, pins that you wear and things like that. I mean, the practical reality of how that's going to change business, I think no one can know. But it is clear that there's no putting the AI genie back in the bottle. That genie is out. And you see with how much investment is coming, that AI is going to just force a transformation of every aspect of business. And you'll see, locums will become, it's already entrenched now in the post-COVID era as a permanent workforce layer.
Mm-hmm.
And again, it's being driven on the client side and the provider side, with the staffing agencies in the middle looking for ways to streamline and automate delivery of these staffing solutions. So the companies that are committed to transparency, building trust with clinicians, being open with their business models, slotting into client technology platforms, and helping providers get conversant in different provider focused
Mm-hmm.
platforms. It's going to change everything. But again, relationships are the central glue of this whole industry, and it's hard to see how that changes
Mm-hmm.
without providers driving. It could be that providers decide they don't want to deal with recruiters anymore.
Right.
So if there's a platform that enables that, could be that eventually this industry radically changes.
Mm-hmm.
That's always been the end goal of technology, is to automate as much as possible and to
Yes.
remove the human equation for good or bad. And a lot of it's bad. If it can be automated, it's going to be automated. And again, this industry is still very fragmented and is ripe for disruption, to use that word that became prevalent in the mid 2000s when software platforms were being developed that replaced outdated and manual business process.
That's true. That's true. Because I come from the IT industry background. So I was in the IT recruiting side, and then we started in our company the healthcare vertical, and I took over the healthcare side. I am able to see the world of difference between the IT industry, how the staffing is done, versus the healthcare industry. In IT, also, we had the MSPs and the VMS that came in, but soon the clients realized that it's not as effective as they think it is effective. Things have changed, and there are only few places where you need to go to get your providers, or the client can go and seek their future employees. But in this industry, I see it scattered all over the place, and there's no consolidation happening in terms of the provider list or the residents coming out, the specialty. It's all over the place. So there is definitely a need for consolidation, a need for streamlining the process, and making it easier for everyone, whether it is a provider, it's the agencies, or even the client especially. And it's going to reduce the time to fill, it's going to reduce the uh, the expense part of it, and it's going to reduce the stress level for everybody involved. So I honestly, I mean, I'm working on something as well, so to ease this whole situation with healthcare staffing, and hopefully we'll all be collectively working towards a solution that will ease this healthcare staffing. I have a question in terms of closing out this particular podcast. It's been we moved from pre-digital to digital to future of AI. What would be your concluding remark before our rapid fire question? And is there anything that you want to tell the audience?
One thing that I did overlook is the rise of APPs, advanced practice providers, PAs, and
Mm,
NPs. I think that's another that can't be overlooked as driving, respond to these shortages. It's obviously faster to onboard or to educate and onboard a PA or an NP versus an MD or a DO. And so that's something, another big trend that I think is going to really heavily influence the industry in the next few years. That's an interesting question. Let me think. um, you know, I think about this a lot. And, my takeaway is that I would say that Locum Tenens is moving from completely relationship based staffing to, in a lot of ways, it's trust based infrastructure.
mhm,
When we consult with agencies, the first thing I tell them is, stop. Don't say that you're the leading staffing firm because everyone says that. Don't say you staff all specialties because they all say that too. You have to prove yourself. Like it's not enough just to claim, So you need to build trust, and to build trust, you do that through credibility. So relationship based staffing built on trust and influenced heavily by AI, because AI will help improve clarity, reduce that friction as we discussed, and will give clinicians and systems better alignment overall. I think that's the closing thought that I would leave the audience with.
Thank you. Thank you. I like that APP is coming up with the AI and also working towards proving yourself rather than just stating something that you think you are. So, what you think you are is not what you actually are, but what you prove is what shows you as. So, coming to our rapid fire question: Locum tenens today, gap filler or strategic workforce pillar?
I think definitely you'd have to say strategic coverage and strategic staffing, proactive staffing solution.
AI in staffing right now, it's overhyped or underutilized?
Both. It's overhyped. I would say it's overhyped and underutilized. Everyone I talk to says, yes, we should be doing it, but a lot of them don't know where to start. And that's kind of to kind of give a glimpse at our future business aspirations where we see an opportunity to provide that service to the industry. So definitely underutilized at this point.
Right. One process in locum staffing that must be automated next. Is it sourcing, matching, or credentialing?
Geez. Matching, I think, is a bit of a stretch because there's just so many variables that I don't know that AI can really handle that. Sourcing probably is a bit more likely, but I do think credentialing is probably the most likely aspect because of
Uh-huh.
the influx of credentialing platforms. And this is what AI specializes in, is taking
Mm.
information and structuring it. And so that's where what I would say the greatest need is at this point, and the greatest opportunity to apply an AI powered workflow to deliver a very meaningful improvement in the staffing process, which of course saves money. And that's what this is always about.
Recruiters plus AI is a threat or superpower?
Mm. It's interesting. I would say superpower, but one thing that I think about a lot is I think weak recruiters are going to be automated out of the system. But I think what we're going to see is the star recruiters, the one who understand people, doctors, what
Mhm.
makes them tick, especially at a specialty based level, because an anesthesiologist is not the same thing as a surgeon, is not the same thing as a PA. or a CRNA. So the ones who are tech savvy and have great people skills are, I think, going to do very well in the next 5 years.
Data transparency in staffing, is it a necessary evolution or uncomfortable disruption?
Well, it's definitely an uncomfortable disruption, but I think it's a necessity because, again, we talk to a lot of companies, both agencies and vendors, and I think because it is a relationship-based business, you clinicians are more educated on locums more now than they ever have been before. And they know, I mean, I wouldn't call them tricks, but they know much more about negotiation, how it works, how the model works, what their value is. They understand all of this far better than before. And so, again, back to the authenticity and the trust building, trust is going to be built on transparency, I think, increasingly. And the companies that are more opaque, those firms are going to have they're going to see their revenue, stop growing and contract. And the companies that are able to do all of this stuff, and it's not an easy feat, but it's coming, and it's gonna drive an industry shift, I think.
VMS MSP. I have mixed emotions about them. Adapt, evolve, or get disrupted.
Again, can it be all three? I think it depends a lot of times. Like a lot of the smaller agencies I talk to, they say that their small critical access rural facilities, they don't want to use VMSs. And so kind of like the classic dilemma of the haves and the have-nots, the companies that are able to do everything are going to grow, and the companies that are not able to play in the VMS world, but also maintain that direct connection with clients are going to suffer unless they have a tangible advantage, like they're really good. One of the companies we advise specializes on oncology only. That kind of deep expertise can help staffing agencies compete against other companies that don't have that expertise as that becomes more important to the healthcare facilities. So who knows where VMSs and MSPs will end up, but it's pretty clear that that trend is not going away. And I think companies will have to adapt and evolve to at least understand how they can fit into that world or chart their own course. And again, I think there's opportunity to do both.
Yeah, that's true. Okay, last question. In 5 words or less, the future of locum tenens.
Sentence with 5 words or just 5 words?
Less than 5 or less.
Continued growth, platformization, normalization. That's 5 words.
So, come again?
Is that 4 words or 5 words?
That's okay. We got it. Thank you so much.
It
I
was very
really
few.
appreciate it. Such a pleasure talking to you. I love the way you think a lot before you say something, and then it's profound. So I like it. And thank you so much. I'm sure my
Appreciate that.
listeners would benefit from this. And to those of you who are listening, follow Cory Kleinschmidt on LinkedIn and subscribe to Locumpedia.com. He has exciting things coming up, and I'm looking forward to it as well. And to all my listeners, thank you for listening, everyone. Don't forget to subscribe to Protean Pulse. We are on Spotify, and you can search for Protean Pulse. And remember to leave us a feedback. I will see you all in the next episode, and don't miss the beat.
Thanks, Rajee.